Hi, everyone, and welcome back to The View. It's another edition of your show when we talk about what's happening in The View, what's going on within our community. And today I'm joined by two very special guests so we can hear about what's happening from the social work department and our community and our patients. I'm Edgar Solis. I'm the CEO of All of You Medical Center, and thank you for joining me, and thank you for joining me as well. Um, Whenever time you're listening to this or viewing this, it's either good morning, good afternoon. Sometimes it's recorded, so sometimes they see it at night. But I would like for my guests to introduce themselves.
Hello, my name is Diana. I'm a clinical social work supervisor.
Hello, my name is Hatsuki Murata, member of the Patient Family Advisory Council, and I'm also a longtime patient of all of you.
So thank you, Hatsuki, for being here. It's very important to us to hear your perspective, our patient's perspective, our community perspective. And Diane is here as well because it is Social Work Month. March is Social Work Month, and this year's national theme is Uplift, Defend, and Transform. This thing reflects the powerful role of social workers play in the lives of our patients and our families every day. At all of you, we see this impact almost clearly during life-changing moments. Today, I'm joined by Hatsuki, a member of our Patient Family Advisory Council, and I'd like for you to start sharing your story with us. Tell us how you started your relationship with all of you.
Well, thank you for having me here. I feel so special.
You are.
It's special. Thank you. So I have came here and I was diagnosed with stage 4 breast cancer. And from there, just the news is shocking. But after all of you, it has like everything pretty much here. The lab, the CT scan and mammogram. Um, so it was really I feel really great to be here, to be um treated and then just go on in my journey to fight cancer. But when in the beginning, I was overwhelmed and confused, and it's kind of hard to get myself together. But from there, I was actually connected with social worker Diane. She actually gave me a call, and when I met her, I was not sure what how it's gonna go, but she actually helped me guide through not just the map of the overview, but she will even ask, so how was the appointment? What is any concerns or do you have any questions? And social workers they talk to a lot of patients, so they kind of understand what the patient's going through, what the problem they may be having, and with that, what Diane did is she will gather any information she can get and trying to help the patients for their needs. One of them that she helped me with was because I live in Lancaster, so it's about 45 minutes an hour away. Sometimes I couldn't drive because the stress or anything and the traffic
Yeah.
and being a little girl, not gonna be really good. So my fiance will drive, but he'll have to take a day off to just drive me. And that's when she said, "Hey, you know what? I have all these phone numbers that you could get the ride here." That helped a lot. But she also has so many different informations. So social worker, what she does is maybe it's not a doctor, but it does help the patients of the little needs. And that's very important. And I was very surprised to see at the hospital was just a doctor and nurse, and that was it. And any other helps, I'll probably have to go look for myself. But when you are dealing with illness, you don't have enough strength or the mindset to go search. But I'll just go to social workers and say, "Hey, Diane, what about this? And what about that?" And she's like, "Hold on a second. If I don't have the information, I'll find out. But let me go look." So it is so great to have to be a patient here. And when I was diagnosed, The doctor told me 1 to 5 years, but I'm going on the 8 years. And with the stage 4, doctor almost like to say, almost kind of like in remission. It's all because the all of you, everybody works together, and they're like an army that I have to fight my illness together, and just that really encouraged me and gives me the hope to keep going. So I also want to say thank you for everybody that working here, because your work is important and it definitely changed my life in a good way. Say thank you.
Thank you, Hatsuki, for sharing your story. It's such a powerful message that you made. There's a couple of things that you mentioned that our physicians, our clinicians take care of your physical body, but we also have a team. You mentioned it's an army, right? An army to fight cancer that's behind you, supporting you. And so, yeah, Diane, tell us about the care beyond just the physical diagnosis, right? There's everything like resources. Tell us a little bit more about that.
I think it means really it means everything from what Atsuki shared because we are a team and we're here to support the patients. And when we talk about uplifting patients, defending and transforming, I think what that really means is that a diagnosis like stage 4 cancer really impacts every dimension of patient's life, like emotionally, socially, financially, and medically. Our role is to walk alongside patients through those moments, to uplift them when they feel overwhelmed, to defend their dignity and access to care and help transform barriers into pathways forward. Hearing Hatsuki say she felt empowered, that's the heart of our mission.
Yeah.
Really.
Yeah. Thank you, Hasuki, for not only trusting us to share your story, but also trusting us for your care. I'm very proud of the work that we do here at All of You, and it does take a team. It is an army of clinicians and healthcare workers from radiology to lab. You mentioned social workers, case management, all that supports the care. And I appreciate you sharing your story, and I'm so glad you're well today. And thank you for being here and telling. What else would you like to say? I mean, beyond that, I mean, I know you've been part of the PFAC, the Patient Family Council. Tell us a little bit more about that work.
On those, I wasn't sure if I would be any helpful, but as a patient, I do see my side of how the treatment will be, all small things. And by sharing that story, also made all the other counselor to think about it, and it says, oh, we could do this, or we could do that, or we will make kind of like pamphlets, what does patient needs, and to able to share that and to be part of it and alive, that makes it really good. And I will love to just keep going to the council and try to be part of it and see what more that we could get done, because I do want it to see the all of you to develop more and better. And I would love to see the more patients coming in to have the support and the help they need and treatment and to live. Basically, as a patient, we put our life in your hands, and with that, this place here done so much for me that I would like to see more patients to get that and
Yeah.
receive that too.
And I think you're doing it, Atsuki. I think you informing the care, that the policies, the practices that we provide here is super important. So you're also touching our patients' lives by improving it from a patient perspective, informing how we should address the care, the protocols, the policies. You're part of that work. So you are on All of You healthcare team member as well. So thank you so much for that work as well. And Diane, you said something very powerful that I want to go back to, that a diagnosis like stage 4 impacts every dimension of a person's life, emotionally, socially, financially, medically. And to me, that is exactly why social work is not an option in healthcare. It's foundational to the work that we do here. Um, we've all been there. We've all had, we've all needed support at certain points. And this is exactly why social work uh, uh, is part of the healthcare team. when someone's world shifts, medical treatment alone is not enough. We need to support uh, not only navigating through the complexity of healthcare, because it is complex, right? Hatsuki,
Oh,
you have to go to this appointment and you go to that department, and folks like social workers are there to help you. So thank you so much, Diana, for all your work. To all our social workers in the social work department here at all of you, thank you so much. Let's remember that the theme this year is to uplift, defend, and transform. But here at all of you, it's not just a theme. This is something that we practice, and this is something that we promise our community and our patients. So thank you so much. Thank you, Diane. The entire social work team, thank you so much. And again, Hatsuki, thank you so much for being part of the PFAC and being here to share your story.
Thank you for being here. My pleasure.
All right, on to announcements. And thank you, Diane, for being my co-host today. Couple of announcements. Payroll, Payoff, Audit. Only permanent DHS employees hired on or before March 3rd, 2026 must complete the payroll reconciliation payoff audit form. Contracted employees, those with a C number, are not required to complete the form. The deadline to complete the form is by March 24th, 2026. So it's a short turnaround, short deadline, but it's an easy thing to do. Scan the QR code on the screen. Um, Click on I still work here. There's a box that you can just click and you submit, and then you're complete. So please do that as soon as possible. And we are highlighting Women's History Month. March is Women's History Month, a time to celebrate the incredible women here at All of You Medical Center who make a difference every day. We honor the dedication, leadership, compassion of our staff, like Diane, whose work supports our patients and colleagues alike. Patients like Hatsuki, whose courage and resilience inspire us all.
all right. In our next upcoming episode of The View, we will honor the women who inspire us with their dedication, passion, and hard work. If you know a woman who deserves the recognition, it's not too late to nominate her using our feedback button. Simply scan the QR code on the screen and submit your nomination. Thank you for helping us celebrate.
Yeah, and we have a superwoman in Diane here today. Tell us a little bit about yourself, Diane. How long have you been a social worker?
I've been a social worker for about 5 years at all of you. Prior to that, I was in Orange County doing child protective services. So yeah,
Yeah. And how you like it here at all of you so far?
we don't do field work, so that's perfect.
All right, all right. Yeah, keep seeing it from one location here at the hospital as well. Okay. Um, Also, it's Patient Safety Awareness Week from March 8th to the 14th, and we proudly observe this week. It's a time to focus on the importance of safe, high quality care for our patient. The Patient Safety Office plays a critical role in keeping up with our patients safe through different mechanisms, and I'm sure you've talked to a lot of the staff with Dr. Spiegel and her team coming out into visiting everyone on the floors, visiting your department, and talking about how do we promote a culture of safety through team steps, patient safety rounds, H3 huddles. And I see you're part of the H3.
Yes,
All right.
part of it.
All right. Tell us a little bit about that.
Um, I think one thing that is super important when you're trying to support, providers, nursing and everyone else on the care team is that you want to help healers heal if they're going through hardship. And we can do this H3 during work hours. We're available to you. So we want to be there. And let's continue this path of compassionate care.
And that's one of the mechanisms of how we support patient safety here as well. We also track and report incidents. We monitor safety goals. We act as risk management liaison and patient advocates to ensure that every patient and staff member is safe here on campus. And again, this year's theme for patient safety is Team Up for Patient Safety, because it does require a team. Just like Matsuki says, right? It's an army for patient safety. We also are celebrating Registered Dietitian Nutritionist Day on March 11th. This celebrates the professionals who play a vital role in patient care and overall wellness from a dietary perspective and nutritional perspective in patients' health. They support patients from inpatient units to specialty outpatient clinics, making nutrition a key part of treatment and recovery. So thank you to our nutrition team for your expertise, innovation, and commitment to improving lives every day. And they're currently rolling out a program that updates the way we do diets for our patients. Have you heard of that? So we have different diets for our patients depending on their ability to eat, and so it's shifting to a different model, a different protocol. So a lot of work that they're doing. Thank you so much for your incredible work. Have you seen this show before? Please say yes.
Yes.
All right, good. All right, so you know about our trivia of the week, and this year's trivia question, or I'm sorry, last episode trivia question. We're going to announce the winner. Last week's trivia question was: LA County Health Services runs a food distribution clinic to provide fresh produce to patients, staff, community members across the county. According to the 2025 annual report, approximately how many people were served through these food distribution programs last year? And so the answer is 96,500 people were served at food distribution clinics. So this is a great way that we talked about how we support a patient from different dimensions, right? Sometimes they don't have access to or have the resources to be able to purchase fresh foods. And so we meet that need here at All of You. And so the winner for this week is She Rise Ford, a telephone operator. Congratulations. You have just won an All of You branded t-shirt. Please come to hospital administration, say you are the winner, and they'll hand you your shirt. So thank you very much. And this way, we did a different way to pick the winner. Last time we said it would be the first person to answer, and there was a recommendation that we do kind of a random drawing, and so we did. And so She Rise Forward was the winner. So thank you. All right, help us with the next week's trivia question.
Right. So for next week's trivia question is, in light of Patient Safety Awareness Week, who is the patient safety officer at all of you? Scan the QR code to submit your answer for a chance to be featured on our next episode and win an OVMC branded t-shirt.
Yeah, so submit that through the feedback button and let us know who you think that is. And I think I gave a spoiler. I think I said the answer earlier. So go ahead with the rewind button and you might hear the answer. All right. On to feedback buttons. Feedback button inquiries. This is where we hear straight from you, your comments, your suggestions. We still want to hear from you. Any questions that you may have, please share your thoughts with us. First is why would it even be an option not to include O2, O3, and O4 in the security company? Um, I don't think we said that it's not an option. They're definitely going to be included in the security plan. I think all departments, all campus, even beyond our campus, is included in how we determine what safety protocols we should apply to our campus. And that does include the clinics. We do incorporate clinics, even non-patient areas, because there could be vandalism, there could be break-ins. And so we include the non-patient buildings on our campus as well. So don't feel like the clinics are not being part of the new security plan. They absolutely are. But thank you for bringing that up. If you have suggestions, please submit them through your chain of command or through the feedback button or participate. We're going to have a town hall focus on safety and security where we can want to hear your feedback as well. So we're listening and thank you for your information. That was it. Only one this week. Oh, we got to hear from you all more. We want to know, how can we improve campus? What do you like to see? If there's things in the kitchen menu that you would like to change, any suggestions are welcome. So please submit that through our feedback button. All right, so we've reached the end of our episode. Thank you for joining me for episode 23 of The Viewed. So today we celebrated the courage of patients like Hatsuki, the leadership of Diane, um, and the dedication of our social work, nutrition, and patient safety teams. And it's important to hear patient stories because every story reminds us of the care and compassion and the teamwork and the individual lives that we impact every day. Lives like Hatsuki. And even as a healthcare worker, we're impacted by the patients that we serve. I'm sure, Diane, you have stories of patients working from, in either in Orange County or here at All of You that you'll never forget and had an effect on your life. How do you deal with that? How does a social worker, because you guys deal with them very difficult and challenging situations, how do you continue to, mm, you know, be focused and take care of yourself?
Self-care is definitely important, Edgar. But I think one thing is what I take with me when it comes to my passion for social work is, um, there was a kid, she was cutting, and once she stopped cutting, she gave me her razor. So I have it at my desk.
Oh,
So
my
things
God.
that remind us why we do what we do every day.
Thank you for sharing that, Dan. That's just a powerful message, right? Of the impacts of that us as healthcare workers have on our patients and their lives. Thank you so much for tuning in. You guys all make a difference every day. Sometimes we don't see it, but trust me, you make a difference. Stories like that, or the stories that like Diane just shared and Hatsuki. So thank you to you all. Continue to support each other, stay safe, and practice kindness every day. Thank you so much.
Thank you all.